Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN. Healthy you, healthy nation, healthy world. I'm Nancy Valentine, PhD and registered nurse. This show is dedicated to you, the consumer. We hope through our discussions that we will bring information to you for your thoughtful and deliberate decision making so that you can take more responsibility for your health and have better health outcomes for you and your family and community. Let's talk about our topic today. Our topic today is planning for your estate and your life, the role of financial planning and advanced care planning in meeting your goals for security. To many of us, the term financial planning or estate planning conjures up images of extremely wealthy people paying lawyers huge amounts of money to set up complex trusts and elaborately complicated wills specifying how their riches will be distributed when they die. You may say, I don't really need that, not something I really want to think about, but perhaps you should think again, because financial planning and estate planning is not just for the wealthy or for the elderly. In fact, even if your assets are only worth $25,000, some aspects of financial and estate planning are important for you. If you have a blended family or more substantial assets, of course, this is a critical aspect for you to consider. What we will be discussing today with our guests is the role of financial planning and a new approach to the end-of-life care that you may have to consider. And it's referred to as ACP, Advanced Care Planning, that will ensure that your wishes for how you want to be treated in the event of a serious illness will be respected. Today we have 2 trendsetters and mavericks in their respective fields. They come from 2 different walks of life. Our guests today are a financial planner and a physician. They will discuss how financial planning works and how ACP, Advanced Care Planning, can replace less effective advanced directives, thus ensuring that how you want your life to end will encompass both the financial elements and the care you want to receive. Let us welcome our guests, and I would like to tell you about our first guest, who is Mr. Robert Sims. He is a well-respected financial planner who has been practicing on the main line for 50 years. Now you may be wondering, now what did Bob Sims do for 50 years and is still doing it? Bob is one of the early pioneers for financial planning in the United States. He was the founding president of the Delaware Valley chapter of the International Association of Financial Planning and has lectured nationally on this subject. Bob is currently the chairman of Sims Financial Services located in Wayne, Pennsylvania, and his firm focuses on developing, implementing, and monitoring personalized financial plans for individuals and businesses. He is a certified financial planner, a chartered life underwriter, a chartered financial consultant, and holds a Master's of Science in Financial Planning. Welcome, Bob Sims. Our second guest is a physician at Mainline Health, practicing from Bryn Mawr Hospital and from Lankenau Hospital, Dr. Carl Allsweet. He is the medical director for palliative care at Bryn Mawr Hospital and the owner of Dr. Carl Allsweet Advanced Care Planning, the first physician specializing in advanced care planning. He also is very involved with bioethics and bioethics committees at Mainline Health. Dr. Allsweet started as a surgeon and decided in mid-career that he really wanted to deal with palliative care, that area of caretaking that really takes a look at how patients, through goals that are oriented through their conversations, education, and expert pain and symptom management, really help people to move through illness. Through his private practice, Dr. Allsweet ensures patients' values regarding end of life are honored by providing professional guidance and expertise relevant to the patient's individual situation. So I want to welcome Dr. Carl Allsweet and Mr. Bob Sims to our show today. Yeah. Now, thank you. Thank you for being here.
Thanks to be here.
Very good. Bob, let's start with you. You know, not everybody knows what financial planning is all about and what it entails. So maybe you could just really sort of level set that for us and just give us the ABCs of financial planning.
A, B. We're trying to get everybody to know, though, all about it. Financial planning is evolving from the whole financial industry. It was formerly an insurance man, it was a stockbroker, there was a accountant, a lawyer, everybody had specialties, and then somebody had to oversee and coordinate a lot of it. Not that there's still not the specialties that are required, and even within the financial planning industry, there are specialties. For example, in our office, we have 3 people that are certified divorce financial planners, and that's what they do, getting financial affairs together in anticipation or in the middle of a divorce. So there are subspecialties. But the question is getting someone who can work with you, and I know what doctors here, I know is what he thinks, is that we're working for the client and helping them do what is best for them. And we bring in the specialties. I'm not a lawyer and I don't practice law, but I have to be involved with a lot of it. I don't prepare income taxes, but I have to work with all the accountants and get them done. So it's a question of the coordination of your financial affairs. But that all starts with defining some objectives. You know, where do you want to be at a given time, and what kind of risk level you can live with? There's an old story that you know, what percentage of your assets are exposed to what percentage risk and opportunity, and that pertains to all of your costs. Today we're dealing with a major problem is the amounts of wealth literally in IRAs and company plans that people have. They do need someone to sit down with them and give them some guidance. So the financial planning is sitting with someone and being a good listener, defining where they want to be, and some of the choices that they have to be. You know, do I or don't I buy a second home? Do I or don't I take a vacation? Where are my children going to go to college? What's the best way of accumulating that money? So, you know, 529s, no one ever knows about it, but 529s where you get a tax deduction and it comes out tax-free. So the financial planner has to be aware of a lot of these things as they apply to the client. Some say, well, all my kids are going to be scholarships and they're going to do fine. They all aren't. So we get that, but when we wind up somewhere along the line, the kids are going to leave, and so we're going to get to that point where we start to plan how do I want to live my life?
Right.
And that's where we're talking really here.
Right.
And my doctor says to me, I said to him, you know, I'm not 25 anymore. He said, no, you're not, and don't act like that, you know. So the question is there's certain limitations and there's certain restrictions, and so we see that as well. All of our friends get into different kind of medical problems. So the way they're going to live, and maybe they should not live in a great big house, and maybe they should live on a one-floor building. So these decisions financially have a lot to do with their physical.
Right. Well, that's very helpful. I mean, that's a very good way to start out. And our topic today is really where financial planning, which, as you said, really covers all aspects of really everyone's life, and how that really particularly impacts the healthcare aspects of one's life. And Dr. Carl Allsweet's going to talk about what he is doing with advanced care planning, and that's a planning function as well. So he's going to give us just the basics of advanced care planning, and then we're going to talk about really where is the intersection of these two.
We can talk about cases then.
It's good to be here. The advanced care planning is a new process that really came out of the changing field of healthcare. Healthcare has gone from people living very short periods of time when they became sick to living actually very extended periods of time with some sort of form of a disability, and that's fine if that disability is what you want to live with. The advanced care planning is the process by which you sit down, you define what quality of life is good for you, and then it's done with a team of clinicians to help bring that about and make sure that the proper health care is being given to you at whatever stage of life that you are.
Right. Okay. So with that process being relatively new, you know, that people are now formally, through your practice and perhaps through the work of palliative care teams in various hospitals, people are now really getting more focused on how they're planning their end-of-life care, as you say, based on their values. And I'm wondering, Bob, do you get into conversations with your clients about how are they going to deal with end of life, or is this something that some people acknowledge, some people don't? What's your experience?
A lot of times we're involved in before then because somewhere along the line there's a physical impairment or something like that, and we say, well, I think you've got to get out of your house. You should be on one floor. It would make sense for you. You should change your lifestyle, and so we get talking about what's going to help them as they go down the line. Now, everybody is on their way to somewhere going out. So you say, well, what can I afford to do? If I can release them of a lot of the tension financially, I think, doctor, they'd probably feel a lot better if we get them less tension. So we're working with the way they apply their money, what kind of risk levels they work with, and how long, where they should live. And then as they need the doctor, they need the doctor's advice, and as it gets close to the point, you need some real special advice. And that also gets into the way that you want to handle your life. I mean, could you say, everybody says, I want everything left equally to my children. Well, then you get in a case that there are 2 divorces and 2 are not divorced and different children. So the financial affairs, you're trying to get those jockeyed and managed for them. It all leads to somewhere along the line how to want to live.
Right. So it may come up, is what you're saying.
Yes.
It may come up,
It's part of
but
the
it's not
plan.
necessarily dealt with indirectly. I mean, some of the things that you're dealing with are the nuts and bolts of, your living arrangement, your disposition of your assets. But what I'm hearing from Carl is that there really is another process that people could pursue long before they're in a hospital. Could you give us some examples of people that have taken advantage of this care planning process? Like they took advantage of a financial planner, can they take advantage of an advanced care planner long before they're really in the middle of a crisis?
Yes, recently I had a couple that came to me, and they were very well off financially. But one of their questions and their very big concerns is that they did not want any of their wealth to be given to their health care unnecessarily. They wanted to maximize what was to be given to their children, and so they actually were a couple that wanted to very much limit how much health care they received if they became disabled to the point where they could not be active or be active in their own home or live in their own home. They really wanted to preserve the wealth that they had built for their loved ones.
That's very interesting. So their motivation came from asset preservation, so to speak.
Very strong motivation. Very strong motivation with people. They want to make sure they want to be taken care of, and they want the direction, but still they'd like to leave as much as they possibly can.
Right. So let's walk through this. So I mean, not particularly that couple, but just in general, when people say I want to not spend a lot of money on my end of life care, how does that really play out in reality? I mean, what kind of directives, so to speak, or values would be written down that would help healthcare treaters, a doctor or a hospital, once they would get into it, to really know how to navigate around that person's value system?
Well, take for example this couple. They said that the husband was very clear that if he was to the point of disability that he would have to be living in a nursing home, that from that point on he would not want to receive further life-lengthening treatments. So that meant the next time he got an infection, the next time he got a pneumonia, that he would rather be treated symptomatically, making sure that he was kept comfortable, but not necessarily to keep him alive.
That's very interesting, because typically for our audience, having done some work in a nursing home, limited, but people in nursing homes typically get an infection or they fall and they have to be evaluated. They're immediately transported by ambulance to a hospital for that evaluation or for that treatment. Nursing homes don't typically do a lot of these interventions. They really need to have a relationship with a community-based hospital, for instance, that will see their patients. So you're saying in this case, that gentleman would say, I don't even want to be going to the hospital for any kind of evaluation or treatment. I just want to stay in the nursing home. And if I die in 5 days or 3 days, so be it.
That's fine by him. And that was his values and his wishes. Now, there are other people who say, no, I want to be treated for my pneumonias, or I want to be treated for my urinary tract infections, or I want to live on machines for as long as possible. But this particular person, he wanted to make sure that he did not burden his family in an emotional sense or a financial sense with his medical care.
How about from a legal perspective? Is there any problem legally with the nursing home feeling like they have to do something for someone that would be, for instance, in great pain, or feel that they should really be seen by the next step in the healthcare system? Or once these are written, the legal aspects are really basically addressed?
Any hospital, any medical care community, any medical care facility, as long as they are aware of what the patient's values are and have proper plans in place for any eventuality, yes, they are relieved of burdens and likewise as the families are.
Now, tell us about advance directives, because some people do have advance directives, and I think they feel that covers them. Is that true?
No, that's not correct. Most advance directives, the vast majority of them are that you can download offline, that are template form, or that are derived from standard practice, really only come into play when a person is in a terminal condition or a permanent psychological impairment. Then it dictates treatment after that point. Such as this gentleman, he said once he started living in a nursing home, he did not want any further treatment, and that he certainly wasn't in a terminal condition.
So one could see that in some cases, people could put X number of dollars aside, and they could say,
This is where
this is it.
This is a lot where we're in there trying to get their affairs in order so they can take advantage of, and there are a lot of ways, efficiencies tax-wise. We just went through this over the last 30 days. As for a while, you used to be able to leave $1 million. Now you leave $5 million. Then we're going to cut it back to $1 million, and now it's back to $5 million again. So how much can you leave to your family before it's taxed?
But still, I think that is a political, hot potato right now in terms of what's happening. But what I think we're talking about now is individuals making their own decision and taking responsibility for.
Very difficult for them to make their own decision. That's the reason why you need an advisor, coordination of the advisors. If they can get certain level of care and prolong that, and I know that's what you want to do too, is make sure they're comfortable. And they're going to be arriving, and then they get to a point where they've got to say, hey, listen, I have one of my very good friends who's 86 years old, and he has a bad heart, and he has so many side things. He said he won't even take a trip anymore. Well, he's going to sit and talk to you and get himself how he's going to live and what you can do to guide him. We work on where you're going to get the money to take care of that.
Right. But I think
maybe change your whole financial life.
Right, but whether you leave $5 million or $1 million or you leave $100, I mean, what I think we're talking about is how you do coordinate, and some people are going to cap in their own minds how much money of any amount that they have they're going to put to healthcare, no matter what. So that's what I'm hearing Carl say, that if there was coordination...
You spend whatever is necessary to take care of them.
Let's talk about where people do get money, for their care, whether they want a short length of stay, so to speak, on the planet once they get sick, or they want to put all their assets into living as long as they possibly can under any circumstances. When we first started out with Social Security, it was really something that we thought was going to take care of us, for life. And life was what?
68.
68. So you were going to retire when you were 65, and the table said at that time.
That's why they don't have to pay you for 3 years. And
only pay you.
They only had to
3
finance
years.
enough money
Right.
to carry them for 3 years.
Right, and then we
Not
had
anymore.
in the 60s, we had Medicare come in, eventually Medicaid.
We're living longer.
We're living longer. So part of what we're talking about in this coordination of financial planning and advanced care planning is how to coordinate for the long term. Now, you mentioned that some people that you have seen in your practice want to live under any set of circumstances as long as possible. Is that because they really want to do that, or they're misinformed about what the experience really entails?
In my private practice, I haven't ever actually run into some people. I've had casual conversations where people have said that. When I really get down to having very in-depth conversations with people, it seems as though everybody has their certain degree of disability that they do not want to live with. I think it's a matter of having that conversation before some people are even aware that they have that feeling.
Right. But what we're talking about is how to take it from casual conversation to really formalizing the process, and that's what you're talking about.
You need somebody with the specialty you're talking about.
Yeah.
Right.
That's exactly what, that's the need. It's a whole new specialty.
It's a whole new specialty.
A whole new specialty.
It was commonly heard when I was practicing as a surgeon to say, well, I want everything done unless it's to no avail. And which seems like it makes sense, but to somebody, to what is to no avail, and that is what the question is for each individual person.
Right, because to no avail has many different interpretations, and that word is a very subjective term.
Correct. Yep. It's very meaningful for that particular person. I think every conversation I've ever had, people are very clear about what their to no avail is. It could mean not living in their own home. If I'm not living in my own home, I would rather not be alive. Other people would say, if I can't interact with my family, I would rather not be alive. My grandfather was, if I can still comprehend sports on TV, I don't care where I'm living. I want to be alive. So it's everybody has their particular values as to what the quality of life is.
Right. So the role of the financial planner is to help people garner as many assets as possible, to preserve them as best as possible.
Manage them under a plan.
And manage
not
them under a
get
plan.
as many as they can. Because today you've got all these people that the pension plans are shutting down and they don't have all the money that they should have. Sometimes you say I just had one of my very dear friends, and I said, you got to move home with the kids. There's no question about where you're going. You got to move. Now, still pretty healthy. I guess the gal was 72 or something like that, still working. Not work full-time, part-time, but she did not have enough money, so she had to move home. There's more of needing more money than anything. So how are you going to live? And you want to. Actually, we all want to live. If you have our marbles and all that, and you want to enjoy life, watch the Eagles win again. But the point is that how are you going to do it? And you need the counseling with somebody like Doc that easy goes over. Let's talk about how you're going to do this.
It just sounds like a beautiful handoff. I mean, your role and responsibility, and has been very successful for 50 years, helping families really deal with their asset management and having a very solid plan, and keep revisiting that plan when anything really changes in their lives.
That's right.
But this is like the next really critical step, is for people to say, after they have their financial plan, instead of saying, gosh, I'm glad that's finished, I'm done, it's almost like that's one thing, and then this is the extension to really take it to that next step.
They have to bring the doc in sooner than the final hours.
Right. So it's all part of that pre-planning.
Yeah, absolutely.
Yeah. Do you find that you're getting calls and you're getting interest from people that are really doing this on a pre-planning basis?
I think there's a subset of the population, particularly those people who have had family members live a prolonged period of time in a disabled state or in a chronically ill state that were very unhappy. Those family members seem to be very motivated to come and get their own plan in place. So yes, I do think that there's an increase in interest, but there is still quite a number of people who do not want to talk about end of life or critical medical conditions that they may end up in.
Right.
But they'll live better if once they get the peace of mind talking to you, or I think are talking to us, working together. Let's talk about how we're going to work this thing out, and we can work it and can have some fullness of life. Everybody, but it doesn't have to be the last hour, last day.
Right.
I've been with couples who I was called in essentially by usually the wife to have these conversations. the husband is not too interested, doesn't see the need for it. But after we have the conversation, we get the documentation down, we have a plan in place, both of them leave with a lot of relief and say, this is a good thing. It feels good to have this taken care of.
Right, right. I think that your point about people doing it really proactively is fascinating, because so much of healthcare is one of these things where we don't know a lot about things that we haven't seen or experienced. You know, it is a very complicated business. It's a very complicated process. But once you've experienced it, like people who have seen family members who are seriously ill, incapacitated, can't get out of the healthcare system once they're in, I often refer to it as, for some people, it's like Hotel California. You get in and you can't get out, because people are sort of locked in to more tests, more procedures. Now that may change with healthcare reform and moving to a more capitated arrangement where hospitals or treatment teams will get just so much money to take care of people with long-term illness such as cardiac conditions, diabetes, and everybody's going to have to figure out how to manage a lot better with a lot less finance. But in this open-ended system that we've lived in for so many years, more tests, more procedures, more duplication of the same procedures just adds more and more expense to the system, but more and more, in some cases, pain and suffering for the individual. So you're saying that this is a way for people to then seize the control for themselves so that they don't have to go through what they saw a family member have to go through. That's
Absolutely.
Yeah. So how would people find out about this? Are they going to find out from financial planners, or how are they going to find out about how to access these services?
Well, most advanced care planning is done through palliative care programs that are hospital-based. So generally speaking, at the present time, because palliative care is a new field, it's relatively short-staffed. Most of the time they will find out about it if they are hospitalized in a hospital that has a palliative care program. Otherwise, it is going to take somebody trying to find somebody like me who's interested in doing this as a private practice. Sometimes family doctors want to get involved and do this. Sometimes they're not interested.
Right.
So it really is up to the individual consumer's responsibility to seek this out. It is not going to be something that's easily found.
Right. Well, we've established that it is really like finding a needle in a haystack in some cases. I'm wondering, Bob, you as a financial planner and being such a trailblazer in the industry and such a reader of trends, do you think that financial planners such as yourself and others will be sending clients to people like Carl and to other services that may be hospital-based?
Sure. Once you look at the situation and you say, I think, or you really ought to get somebody in here as a specialist to talk to them about this. You're in the middle of refereeing a lot of things. Are we going to sell the place in the mountains or sell the place at the shore because Dad doesn't get there anymore? You know, because he doesn't want to get there anymore, and so we have to start thinking about this process as we get down the line. And who you're talking about it. Some people don't want to talk about it. I've had one of my very major clients who would not even read his wills. I read them, and that's all. I don't want to read them. But you got to read them. You know, this is legally you got to read them.
Well, we'll hope that our listeners listen to the show, because it is a topic that most people don't want to really pay attention to. And that's probably a whole discussion in itself, why in our country it seems like we have a really tough time addressing this, whereas it seems like maybe in some of the European countries they're a little more comfortable with that whole topic. Do you have any thoughts, either of you, from your perspective?
They look at living longer as great, and over there, and the whole attitude is different with their families.
Where, here or
in Europe? In Europe.
Okay, in what way?
Longevity's fine. Here we have such a pace going here. It's different attitude over there than it is here.
But I don't know what the attitude difference is from what you're saying. Can you
Well, we expect
clarify
reality
that?
in the pace that we live, and it's always accepted over there that Mom came home and lived with the children.
I see.
Out here, you get on your own, get your own house, and do all that. Now, with the economics going as it is, people are coming back in here again.
Right.
But no, it's let me make a suggestion. everyone should set some date, some anniversary in their life. I mean, the day we first dated, the day we got engaged, whatever it may be, and that's our anniversary, and we look at our affairs every year on that date.
Now that's coming from a hardcore planner to
yeah,
have a plan every year.
On July the 7th, we're going to sit down and take a look at where we are, physically, mentally, and financially. And if you set that date, then it's not a question. That's our anniversary. No, we're going to talk. How you doing? Well, I think I got to think about moving out of the house, or I think got to tell you the doctor I got a little other problems. And those things will gang up when that's when really they're going to grab you real quick.
Well, that's one of the practices that I do is I contact my patients on a yearly basis because the plans will change. Your advanced care plan and your desires when you're 35 is going to be very different when you're 85. So
set a date.
It's very important to have a plan, but make sure that plan is fluid, it's examined on a regular basis, and that it gets updated.
That's excellent. I think that's a great idea. So it sounds like there are going to be new trends and new teams.
That's right. I think that's good. What we're doing, what I was in the part of the thing when it was just changing. You're the same thing. You're part of a whole new wave of people wanting to do this, and you get people, and once they get to understand, now everybody does it.
Very good. Are there any other points that you want to make in terms of where you see this trend going in the future, where the intersection between finance and end-of-life planning comes in?
I think I just want to make the point that this is something that hasn't had to be done before in the medical end of planning. We didn't have these options 30 years ago. People were not surviving as long. So this is the thing that I just want to make clear that that this is something that is brand new. It's part and parcel of the very aggressive healthcare system that we have, and that it is something that, whether we want to or not, we are going to face it, and that people and their families are much relieved if they do a proper plan and have the proper people in place for the eventualities.
Right. So I think the summary of this discussion is that the good news is that we are living longer and we are more health-driven and motivated for having healthy outcomes. The other side of that equation is that with living longer, we're not going to necessarily be in the same physical or mental shape that we are in 1 decade, 2 or 3 decades later, and that we really need to accommodate for that by having these plans that we have thought through, spoken with our family and friends about, and have really had written down so that they are portable and they are able to be taken to various healthcare settings where we may, be residing, whether we anticipated that or not. Is that correct?
Yes, that's absolutely correct.
So what would be your advice to our listeners? What do you think they should do as a result of listening to this discussion?
My advice is to get into action. You need to make sure that you know what your affairs are. If you want specific things done, you need to make sure that you're contacting the people who can make that happen. Unfortunately, that is going to be the very difficult work, is finding the people that will make that happen. I'm in the mainline area, and I practice all throughout Pennsylvania, but you may have to find out if your family doctor can do this sort of thing. And you may have to find out whether a local palliative care program at a local hospital can help you with this.
Yes. In terms of planning for the expense of this, what do these plans typically cost someone to have?
My fee is generally a sort of upfront fee of about $1,200, which accounts for approximately 4 hours worth of work. I generally work on an hourly basis of about $360 an hour, but about a $1,200 charge. And you and a loved one will have an advanced care plan that will take you through major medical crises or problems. Mm-hmm.
And then how about those follow-ups on a yearly basis?
Those are all covered under the initial fee.
Well, that sounds pretty good, especially if you get started at a young age.
Sure.
You could have a lot of follow-up visits for that fee.
But once you get the thing together, once you have the mental attitude, that's the key.
Right, right.
And I just say, if you don't set a date, though, it's very interesting. Yes, we're going to get there. This is the date we do, and we talk about it. But also, I think it's less pressure in making the decisions. Mm-hmm. We say, listen, yes, I have had a heart condition. Yes, the doctor doesn't really like some of the things that are going on. Well, okay, fine, we discuss it, and I can sit down and how's this thing going to work?
That sounds like a very good idea.
No.
So some people would rather have jewelry on their anniversary, or out to dinner and flowers. But you're recommending a planning meeting. Is that what you're saying?
And that may be the plan. We go out to dinner, and we're going to go out to dinner on that date too and celebrate.
So business first and play second.
No, a lot of playing. Got to be a lot of playing. Got to play.
Yeah, maybe do the planning and then go to dinner.
Right,
right.
exactly. That's
the
the
jewelry.
payoff. Okay. Well, thank you very much to both of you. This is a very, I think, illuminating discussion. And I think, again, we've touched on the fact that it is a topic that we all have to sort of pay attention to. And I know that I don't have this plan. But based on this discussion, I think that it's a very good investment of time and effort. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.